Hello, I am Kristen, and I am a former toxic girl.
Hi, Kristen.
Hi, Kristen.
I am Dee Dee, and I am a recovering toxaholic.
Hey,
Hi,
Dee
Dee
Dee.
And I'm Aisha Thalia, and I too am a recovering toxaholic, and here I am.
Hello, Aisha.
Hey, Aisha.
And today we are joined by two very special guests. We have doctors George and Mario Samaha, MD, two plastic surgeons from the Miami area that are going to come today and join in and let us know about your experiences in the workplace. But we'll let you do a little introduction
They're
because
brothers. That's the most important
We are
part.
brothers. And it's
Right.
rare to have two brothers in the same specialty in Miami. So
look at that.
Such a
Dynamic
hard
duo.
specialty, too. That's a challenge.
Exactly.
Your parents did well.
They did good.
They're very happy.
We call
They
this,
got free plastic surgery. They got free Botox.
nice.
Really? Botox?
Yeah.
What plastic surgery do they do? Can we ask?
if they know,
Sorry,
they'll kill-
pops.
It's a secret.
If they know, they'll kill us.
Oh, okay. Well, HIPAA. So,
HIPAA.
Right.
anyways, to welcome you in, we do have an initiation. And this is just kind of like to get our feet wet, get to know you a little bit better. So we like to ask all of our guests just to tell us a toxic tale. Now, for the sake of you being professionals, we'll ask to keep it light. You can do a tale that you've experienced that was toxic in your practice or whatever, but just get creative.
I can go
Go-
first.
go for it.
Yeah. So recently I had a patient of mine that wanted surgery. We evaluated her and we decided what the surgical plan is. And then she's like, okay, my boyfriend's going to pay. You know, this happens sometimes. You know, I need to talk to the boyfriend and we need their infos. And then she's like, actually, it's two boyfriends. They're going to split the cost.
My girl.
My girl.
And I don't know what to say.
That's what I'm talking
City girls up 100.
So yeah, that's a toxic tale.
That was
That's
good.
very
That's
much
a good
so a
one.
toxic tale, yeah.
Did they pay equally, or did one have to pay more than the other?
I cannot confirm or deny anything.
Just wondering who she liked more.
Yeah,
Or who liked her more.
Yeah,
Really, more
exactly.
so.
they liked her equally.
Nice.
Well, there was our answer.
Right, there we go.
So good. Let's get right into it because there's so much to discuss, like considering the fact that we live in Miami, Florida.
Yeah.
And I know you're booked and busy, you know, but I just wanted to get into the like body standards of today. Like, what are like the inspiration pictures that you're seeing and things that people are bringing into you as a reference?
Should I go? Wanna start?
I'll go. So Instagram has played a big role in plastic surgery. The all the pictures that people post, the what do you call these?
Filters.
Filters. Yes.
Oh my
Filters.
God.
I've
So
heard
filters,
that.
exactly.
Yeah.
Filters shows someone how they, you know, a different
Yeah.
view of how they can be.
Right.
And sometimes they attribute, you know, a quick fix is plastic surgery. And yes, in the past 5-10 years, that's what's been fueling a lot of plastic surgery business. I mean, I don't think it's a great idea or it's not the best way of getting patients in, but
Yeah.
that has fueled a lot of the interest in plastic surgery lately.
And we all
And it's, often they come with unrealistic expectation,
Right.
specifically because of their filters, and they come and start showing us pictures of faces, noses, anything, skin, and they expect us to recreate the
Yeah.
exact same
Like
thing.
super
Skin.
smooth,
Right, yeah.
super, yeah.
Even with face apps, and face apps,
Right.
what's the app?
Facetune.
Facetune,
Mhm.
right,
Facetune.
right. They
Face
come and they
app.
play with their fingers. They play with their nose on the picture, and they expect us to do the exact same thing. So it
Wow.
could be dangerous. It could lead
Right.
to body dysmorphic disorder, stuff like that. So
Do you have a good sense of how to turn away or to direct people to counseling or that kind of stuff? Are you ethical, doctor?
Yeah. So yes, we actually we turn down at least 15 to 20%, I'd say, of patients.
Say so.
You do need emotional
1 out of 5,
intelligence.
guys.
Yeah.
So for what reasons would you turn
A
down
lot of
patients?
reasons. Unrealistic expectations. Some patients, I always say the best plastic surgeon, there's one better plastic surgeon than I am, and that's the gym.
Right.
So,
Right.
I do ask my patients all to, try to lose weight and, do more active,
Yeah.
to be in a more active lifestyle and all that. And then sometimes, yes, we can come and help, and it can jumpstart their life, their active, healthy lifestyle.
Yeah.
So
And then there are a few red flags when
Yeah.
someone comes in to clinic, right? When someone comes into clinic and says, "Oh, I've been to plastic surgeon X, Y, Z. I'm not happy with them. They don't want to operate. Can you see me?" And they start having say, "Oh, I don't like my breasts. I don't like my nose. I don't like my lips. I don't like my body, my butt. Everything." That's one of the biggest red flag.
Right.
And that's when there's a specific way to professionally send them off to see someone to talk
Right.
about this, right? Because obviously there's an issue bigger than what she thinks it is, and that's how we can help them. And as George said, we see about 20% of our, between 10 to 20% of our patients having that specific issue.
Yeah.
That
That's something that we can benefit from having in-house too. Like, if you
Right.
go, well, you guys wouldn't know, and neither would I, but if you guys go into an abortion clinic or something, there's someone in-house that's, a psychological,
people.
exactly,
Yeah.
saying, is this the reason why you guys want to do this? Is it for you? Is it for a boyfriend? Do you guys get that in the practice as well? Like someone doing something because their significant other wants them to do it and not for them?
So, my brother and I
He
have a-
laughed. He has a story.
my brother and I
said I
have,
want titties. I gotta get them.
my brother and I started a private practice called L'Acne Privé, and we're trying to have, we do have in-house nutritionists, for example, that helps our patients before and after
nice.
surgery
Oh, good.
for, optimizing their recovery, either preoperatively or postoperatively. But one thing we discussed is to have an in-house psychologist to
That's
talk
so
to some,
good. That's
obviously not
essential.
everyone, but some people that Mario and I just think that they might benefit from, a second, like a psychology
Yeah.
consult.
Let me tell you, since I laughed about the boyfriend, it commonly happens, at least in my experience, with breast augmentation, right? Patient comes in,
See?
she wants a natural look. She says, "I don't want to look very big," right? For big in Miami, it's subjective.
It's super
Big
subjective.
for someone is something, for someone else could be something else. So we asked them, George and I asked the patients to show us a few pictures of women in bikinis or in a bra that you want us to try and make look the same. And then they show us, and then you have the boyfriend or the husband say, no, sweetie, I think you should go a little bit bigger. Or,
Oh man.
and then there's a small fight. Oh, no, I
Yeah.
don't want to go big. I don't look natural. So that, stemming from the question
I
before.
think in health probably plays a factor too, because look what happened with Kanye West's mom. When she had been told by other doctors that like they shouldn't operate because something with her health wasn't right, but then somebody decided to do it,
anyways.
and like that part was probably scary. I'm sure you
Imagine
guys have to
being
screen
that
people,
age
isn't
and
it? Like
feeling
blood
like you're
work or
still
something?
feeling that pressure to have to go and still get work done at that age. I want to just be chilling. Like I
You would think, but we live in a very ageist society that
Yeah.
looks at women's worth as declining as they get older, whereas
Right.
men, as they get older, it's like, oh, you're
They're
you're
sexier.
sexier.
Yeah.
Like look at George Clooney, and then with Meryl Streep, it's like, oh, she has bags under her eyes and she should get a facelift. So being that we live in this ageist society that devalues women as they age, I'm not surprised that people that are mothers and grandmothers want to reverse the clock. Look, like when I tell you, I am absolutely, when I would get to my 50s or 60s, I would super look into a facelift.
Yeah.
Like a mini something,
Yeah.
because you feel like,
That's not a mini
I
nothing.
want to
With
look
facelift.
absolutely 1,000. Have you seen those
that's
before and
still
afters?
restoring
It's
what you
restoring what you
naturally
probably
look
and
like.
imagine you look in the mirror every day and you're just like, this isn't what I remember looking like or what I even feel
And I
like
understand
I look like.
that,
I
but what I
understand that.
don't understand is
The obsession,
being
the
60
dysmorphia.
and getting double, triple CDs and
I still
Granny
don't
wanted
understand
some
it.
titties.
No,
I could want some titties.
You'd be surprised. One of my patients was 67. Looked like she's 50. She worked out all her life. She watched her diet. She looked great.
And I love that for
and her
grandmother.
skin was good quality, and she already had the breast augmentation before. She wanted them to look better, and there's no really an age limit where we say no,
as long as you're healthy.
as long as you're healthy, as long as you're cleared for surgery, and also because there's no problems, then
I
there's
love
not
that for
really
her.
an age.
yeah.
Yeah.
But my thing is, and here's the thing, because I think it's really important what they're saying to have an in-house psychologist or something. I think that would really benefit your practice because there are people that, like you said, when you look in the mirror, you don't see what you used to see. And that's a psychological thing. And I think that that's like, that takes you back to that when you're attached to something in life, it's going to lead to your suffering, you know? So, because at the end of the day, the only thing that is promised is we're going to get old and, you know, whether or not you're going to die one day, you know? So you can't get attached to every single stage of your life. You have to appreciate it while you're here. And if you don't, then
Age gracefully. But then what are the ramifications of you looking in the mirror at our young age and then, you know, us constantly using filters and then not seeing the person? Like when you look in your mirror without a filter and
it's the same thing.
Because there's so many people we look at people and we meet people in real life and we're like, wait, that's at such and such, like that's not the same person.
I even feel like it with myself. When I use a filter too much, I start to be like, oh wait, what do I look like? You know what I mean? So I start to get confused, and that's why
I confuse myself.
Yeah, so I start to make it a point that I'm gonna do more videos without the filter, and you know, go live and do that kind of stuff.
Preach that, yeah.
I do both because I want you to know that I look different with makeup. That's okay, you know, and I look different with a filter, without a filter, whatever. You know what I mean? Like,
yeah, it's very healthy.
Yeah, it's
it's
just
very healthy.
You got to get yourself out of that attachment phase. Like when you marry yourself to a filter, you're going to feel different about yourself. And that goes.
But we're all sort of hypocrites because we all have on makeup right now. We all want to look our best. So it's like whether it's makeup or hair dye or whatever, next step would be people who can afford it to go in and get their face done. Like how can we look down on that? Because
it's not about looking down on it. It's about you are still going to look different when you get those things done. And that's what I'm saying, you know, like you're setting yourself up for failure if you're looking at it as I want to look the same as I looked when I was 21.
That's
you know?
unrealistic. But you can also still look like your best 67-year-old self.
course,
I think that's what their job is, right? You tell people all the time, I'm sure, you're not going to look like you were when you were 21.
Right.
You're not.
Right. Yeah.
There's obviously limitations to what we can do, and George and I are, set the patient expectation. We make sure that before we go into surgery that they know what they're going to obtain, right?
Right.
And that's another red flag. Like when we tell them, listen, this is what we can do with what we have, the patients either understand it or they're like, no, I want to look like this Instagram, whatever. And then this is where we can, before we do surgery, before we harm the patients, then we can control the situation on, not operating or setting their expectations and whatnot. So it's extremely important for the patient to understand what they're getting into, what we can do.
And the limitations.
And what you can't, right?
And so they can keep the realistic expectations. I think that's what's important.
That's the
like
important
you're
part,
not going to go back to 30, but you can look like your very best 60-year-old self.
Sure.
Sorry, Jordan. And our biggest job as plastic surgeons is not to, we don't inflate, we don't do overly things, right? What we try and do is try and help our patient get not their confidence back, but feel better, right? And
that's good.
but we're doing small things, right? And we're not doing big things. But if a patient's really bothering them how anything in their body looks, we don't necessarily tell them, oh, this is what you should look like. This is Miami. In Miami, everyone has this. We don't do that.
Right, good.
We ask them what they like, right? And then what we think will increase their their confidence.
Yeah.
Is it harder for you just because you're so ethical? There's people who, because you guys are like surgeons, MD, and there's certain doctors who don't have the same level of education. They are doing lipo, and they're
scary.
Board certified, and
He loves to laugh. This one.
No, it was probably
Yeah,
talk about
so
it.
there's a big misconception in Miami, honestly, anywhere in the U.S. A cosmetic surgeon is not equal to a plastic surgeon. Cosmetic surgeon, your OBGYN doctor, can go to certain areas for 6 months, learn how to do tummy tucks, breast augmentations, liposuction, and they can become a cosmetic surgeon, board certified in the cosmetic.
I never knew that.
They do like vaginal rejuvenation and stuff, right?
They can do vaginal rejuvenation.
Okay.
I mean, that they did OBGYN, but they should not be doing breast augmentation or facelifts or rhinoplasty.
you hear that?
That's some anesthesiologists do that here.
What?
As long as you have a medical degree, you can perform plastic aesthetic surgery, cosmetic surgery.
There's
And it's
there's a
misleading
practice
'cause we
down here where people were dying a lot. There's
Yeah.
some, I forget what it's called. I would say it if I knew it. I would call them out. But a lot of people died. They were dying. Like it's like a chop house. They've said that
It's
there have been
sad.
so many people
Here
who have died
in
there. Yes,
Miami?
in
Wow.
Miami. I wish I
Plenty.
would have looked it up
Plenty of
first.
places.
Plastic surgery. I mean, a plastic surgeon can make a lot of money. If they're unethical, they'll make a lot of money for up to 6-7 years, and then at some point,
It's gonna
something
all-
The
wrong is going to
fatalities,
happen,
of course.
and they're going to lose their career afterwards. Or you can be ethical and do the
Yeah.
right thing. I say no to 20% of the patients. I swear to you, these are the patients that bring me even more patients.
Yeah.
So they trust you.
They trust me, and
Yeah.
like at some point we love what we do. We're passionate about it. I've always said, I'm sure you guys heard it before, but if you love what you do, it's like you
never
don't have a
working.
job, right?
It's not working.
And you're not trying to take as much from one person. We never, when I turn on my plastic surgery eyes, I don't tell patients what they need. I never do that. My first question, my brother also, is what bothers you? What would you like to change? What would you like? Tell me in your own words what's bothering you, what you'd like to change, and then I only tackle this. I don't add things to it. I don't.
But you'd be in your head. You'd be like, I know what you need.
It's so it's,
Yes.
Yeah. But sometimes you're like,
but-
you could use a lift, but you don't say it.
No. I give the patient the exact surgery they need.
Right.
But if they, let's say the nose, if
Yeah.
their nose is bothering them,
Yeah.
I'll only focus on the nose. I'll make sure that it's all harmonious with everything else in her or his face. But I don't go on and start saying, oh, you know what? You
Let me
also
add
might
this.
benefit. add
Your
this
ears are
and
big.
that."
I mean, while I'm
Right.
down under,
Right.
I might as well.
Your
get
ears
it
are a
all
little
in
big.
one
Let's
go.
take those back. Your
amount-
shoulders are
The
wide.
amount of patients, I'm sure George had the same experiences, that come into our clinic and says, I'm like, okay, so how can I help you? She goes, tell me what I think I need. And I'm like,
Oh.
no. What can I help you with? Like, what's bothering you?
You don't want me to do that.
What's bothering
That's
you?
probably
right?
something I would say, actually.
Yeah, a lot
I'd
of-
probably
a lot of
come
our
in and
patients-
be
a lot of
like,
our patients
absolutely.
say-
I would. How could you? They're the artistic eye, and I
Yeah.
bet from an unbiased perspective, they don't know me. Like, what would you think would enhance my appearance, even facially?
But that's so subjective.
I know.
I'm not saying I would
Exactly.
go with it, but I would be
Yeah.
liking someone else's
I know,
opinion on
exactly.
what they'd see. Because isn't it true? Is this true that people see themselves in the mirror, but it's actually not what they look like? Have you heard about that phenomenon? It's
Yeah.
like you actually see yourself as a certain percentage more attractive than you actually are.
But not
Wow.
only
Yeah.
that,
Or not attractive, right?
You
'Cause
also
it could be
see,
both.
you also
Right.
see, like we sometimes get patients that come to us and say, "Oh, this is bothering me. My nose is bothering me." And I'm like,
Yeah.
"What's bothering you in your nose?" And they're like, "Oh, I don't like how this bump looks." Right? And you look at them, and there's not
nothing
really
there.
anything.
Right.
But because they looked at their nose so many times, right, in pictures, they had, there's an angle.
They're focused
that
on it.
They're really focused on there. And
Yeah.
I'm like, no, your nose looks perfect, right?
Yeah.
Don't worry about it. Let me show you. And then start explaining to them on their pictures. Look, it's straight. There's no problems. And then they understand. It's just the
They
amount
need
of,
another opinion.
Yeah.
They
That's
need
so
someone
awkward
to-
for me when that happens because we live in Miami, so there's definitely like a lot of times where girls are complaining about their looks or like friends of ours, and I can't stand when one of our girlfriends or something like that, oh yeah, I'm gonna get this fixed because look, it's right here.
Babe, come closer. Babe, you're not coming close enough.
What?
You don't see this?
What are we supposed to be looking at here? I'm just like confused.
I know.
But that's
exactly
where
what
our
you're
jobs as educators and
Right.
as doctors before being plastic surgeons, because doctors do no harm. Right?
Yeah.
There's a saying that says a good surgeon is a good surgeon is a surgeon who knows how to operate, how to do the procedure. A great surgeon is a surgeon who knows when to do the surgery. But the
And when to
best,
not do the surgery.
the best surgeon is a surgeon who knows when not
Right.
to do surgery. And just a simple example.
The
Yes,
bars.
I like
2 days
that.
2 days ago, I had a patient who came in to me. She was supposed to have liposuction 360, very very common procedure we do.
What's that? It's liposuction everywhere.
Yeah, sorry, liposuction is like the front, the sides, and the back. Okay.
Okay.
And then I'm like, oh, anything? How have you been feeling? She had every clearance, all the blood
Yeah.
work was fine. I'm like, have you been? How have you been recently? She goes, good. I just was at the dentist 4 days ago. I'm like, oh, why? And she's like, oh, I just had 4 teeth removed.
What?
So I'm like, okay, what was the reason? She's like, oh, it's just I fell and they broke and they had to be removed. Like, okay, so I called her dentist, right? I'm like, hey, what's up? And he goes, yeah, I removed those teeth because she had abscesses, right? I could have said, oh, okay, whatever. I want to get paid. I want to have surgery. But I canceled her, right? And
Wow.
not because she would have done badly, but the risks of her having a complication from a simple procedure that should overnight or sorry, it's the same day
Wow.
procedure You know, so that's when you should know when
That's
not
smart.
to do the surgery to not
It's
hurt the
ethical.
patient.
And she's a liar.
Right, exactly.
You
So now
weren't
you
feeling
have to
fine.
wait.
You fell
A
and
lot
busted
of
your teeth
patients
out.
in Miami
I don't
do
like
that,
being lied to.
unfortunately.
Yeah,
It's
they
crazy.
lie a lot. I
It's-
don't trust anyone.
Right.
Everybody gets a drug test. The minute
Everybody
before you get
lying.
into surgery,
Yeah.
we don't trust anyone.
Absolutely.
And that's the difference between a good doctor and just a doctor, because unfortunately, when people think of plastic surgeons, they're not judging them how we would judge a heart surgeon. They're just judging the physical appearance. Like, oh, I saw that girl, her ass looked good, and I'm gonna pick whoever did her work,
Right.
rather than
Yeah.
saying like, okay, what was the bedside care like, and what was the follow up like, and it's just her
The
behind
results
looked good,
oriented, yeah.
and that's you guys are the only doctors where your work is just based off of aesthetics. It's kind of superficial, and there's more to you guys than that.
There's so much more.
So many
And
levels, like an
for-
onion.
So back in
It's layered.
I prefer to say a garlic.
Not that
Back-
many layers.
back in the days, a good doctor, they would ask where they trained, how many journal articles they publish in their respective specialty. Nowadays, for plastic surgery, sadly, they're like, okay, what's your Instagram?
Oh my
many followers you
goodness.
have?
Or how many followers
That
you have?
yeah, that's
Which
scary.
is very misleading to patients, because you can, obviously, everybody knows you can buy followers, and you can also Photoshop. So a lot of plastic surgeons that are very
Think about
Instagram
that.
driven, they Photoshop so much.
What? That's tea. Y'all heard
Right.
that?
You see, I never even thought of that.
Oh, you
I
have
never
no
thought about
idea.
that. But you know what I don't like, and I won't say any names. I don't like the plastic surgeons who want to be Instagram stars and be like
That's why I would
TikTok
ask for
stars,
the
because
Instagram.
that might
Yeah.
be the only reason I'd ask, because I don't want to see you dancing around the bed table
Thank
doing
you.
the Dougie and stuff like
Or-
while I'm under like
or posting-
Millie rocking, and you're like, wait a minute, like I need you to be serious. I'm like out cold here, like
Or
that to
posting
me
your
is,
patients
or
is
posting
weird.
I mean,
Yeah.
some people give the permission to post.
If you give
but
permission,
I've been
absolutely.
seeing people
They
under
can- they can
lipo
only
where they're
post if they
awake,
get
that awake
permission.
lipo, and they're like dancing, and the music's all out. I need y'all to simmer down.
Right,
like, that's
yeah,
someone's
right.
life. Like that seems so unprofessional
Dr.
to me.
Miami.
It just seems so scary to me. I don't know. I'm
Imagine
just
that being
glad.
your last video too. God forbid.
So,
Someone
Dr.
dug
Millie
you,
rocking
right while you're under, and that's your last. That's how you remember. That'd be tragic.
Don't forget. So
If they
patients
still post it after that
Doing
and you
TikTok
die,
dances
just
all over
take-
your
they
dead
just
body.
take it
that's
down.
next level. That's crazy.
They
They
take
wouldn't
it
take
down.
it down
They got
because at
doctors
that
doing
point,
TikToks in the ER.
So
The
sadly,
OR, I mean.
sadly, a lot of patients fall for these.
like the
fall for
gimmicks.
this, and I don't know how to fix this. If I know, I would do it like this.
Right.
But podcasts like this, bringing up awareness for people to ask where the surgeon trained,
Yeah.
to ask, if they're safe or not.
Yeah.
The Florida Board of Medicine, or any state,
Yeah.
you can easily go look up if there's any malpractice ongoing on the surgeon, if there's any deaths, things like this. And it only takes, everyone knows how to Google.
Right.
It's just the misleading stuff. One, Instagram, Photoshop, and stuff like that. Two, hiding behind words of I'm a cosmetic surgeon, because they're not allowed to say they're plastic surgeons. If they
Right.
do,
I
they
just
get
learned
sued,
something.
and they get
I did.
yeah, I
too.
learned that
Yeah.
too.
That's
Yeah.
amazing.
It's
Never knew
interesting that we're all in the same generation, and
Yeah.
it's Instagram and social media is really born with us, and I'm sure you guys are Instagram famous and whatnot, but you still didn't know that specific
No, I
point, which
didn't
is
know.
Yeah.
alarming for us, because we try to talk about it, we try to educate
Yeah.
our patients, but it's very common that patients get misled
Yeah.
into doing the wrong procedure, being an unsafe procedure, so you have to be careful.
Wow.
So we always have one little relationship question thrown in.
Oh,
So
God.
guys,
okay.
I want to
They're
know,
laughing.
do you guys think it's okay? Like, let's say you're in a relationship and your significant other ends up gaining a significant amount of weight. Okay. And they don't want to work out.
Let's say it's my husband.
Okay.
Okay.
Because I'll tell
let's-
you right now,
mhm.
if he told me that I would have to like do something, I think anyone who loves you would want the best for you
Yes.
in terms of your body and your health, because it should be not about what you look like aesthetically. I mean, it matters. You should want to keep up your appearance to the best of your ability. But now that I'm married, I can understand that like a lot of people might get very comfortable and just like
Yeah.
let it go. But I think if my husband gained 150 pounds, I would think something was wrong. Because I
Right.
know how dedicated to health he is. I would think that there's a deeper thing there. But I've seen some real sick male podcasts where they were saying, if my wife has a baby, once she has a baby, if she doesn't get it together right away, I'm going to leave. See, that's sick and that's toxic because this person risked their life to bring life into the world. And I know how I feel. Like I looked like I had those cafeteria lady arms after I had the baby. Like they were big, you know. Those
No, you
arms.
didn't.
Yes, I did.
Cafeteria lady.
I'm gonna give Arno a picture of it so he can flash it on the screen right when we talk about this, so y'all can see how big my arms were.
That just means you cook good, girl.
Right. And I was
Right,
really big, but my husband never made me feel bad about it. He never
that
mentioned
deep-fried
working out.
tofu.
He didn't say deep fried tofu. I'm vegan. He never mentioned anything like that because it's like you got to give people time to get back. And I see
Right,
people that have babies and forget that there was a miracle that took 9 months to create. They want to snap right back into their former self. They won't even breastfeed or attempt to because they want to get right into surgery. Where y'all know, I just told them, like, I have one deflated breast implant. It's one titty, like 2 chains, but one tit. Like,
That's your rapper name.
It's my rapper name. It's one tit now. So and it bothers me aesthetically. I look in the mirror. My 6-year-old said to me, "How come this side's up here and this side's down here?" And I was like, "Go play, like go
Who's the
play."
future plastic
And
surgeon?
she is. She's like, one side's here, one side's here. And I was like, and your arm's jiggly, bye. But I do get where people want to fix those things, but you shouldn't be pressured by your significant other to change it. He knew I want to finish breastfeeding before I come to y'all to get some new, you know. But I do understand that I think it would be important that you get back to where you are in a healthy position before you would decide to go under the knife. Like you should. There's an underlying cause because I'm sure that you know. Remember, like that one girl we know that she kept getting lipo. I'm not gonna say her name, but she kept, and then she would cook all bad and deep fry everything, and then she would still. So then she would have multiple rounds of
4 times,
and it was like,
still...
see, you didn't fix the underlying cause. If you're not gonna change your diet and your exercise, what is lipo gonna do? And me, I'm scared to even get my boobs done again because I'm scared to go under the knife because. What if I don't wake up and like I have kids?
Yeah, of course.
You know, so
and when you suck it out of everywhere, them shoulders and arms and chest get real big when you still eating that deep fried catfish. Okay,
You know what's
Or
another
tofu.
factor?
chitlins.
I want to laugh into the
Maybe
mic.
looking like little wrestlers.
You know what's something you cannot liposuction? I mean, you can liposuction a lot of things, but
What?
you know what you can?
What?
Heart fat. The fat around your heart. You can't liposuction that. So if someone is
right.
not healthy,
Arteries. Mhm.
someone
Yeah.
is not lets themselves go for a long time,
Yeah.
you know, that's going to cause a lot of problems, hypertension, heart attacks, and so forth. So,
And to
Right.
look healthy and be unhealthy is a scary thing.
Yeah.
But
really
that brings us to the body positivity part that we were talking about.
Yeah.
We were wondering, a lot of people, I've seen a lot of people online, they get all up in arms when they see women who are comfortable in their bodies at whatever stage they are. And I am one of those people that love to celebrate them because I think it doesn't matter. People say, oh, you're celebrating obesity. I don't feel like that. I feel like I have family members that just because they're bigger doesn't mean that they shouldn't have joy in their life, that they shouldn't have something to wear, that they shouldn't feel comfortable in a bikini. I don't think it's them celebrating obesity. I think it's literally just them celebrating where they are. And we don't know if those people lost 100 pounds to get where they are. Even
You
if
just
it's
said it right
200,
there.
you
They're
don't
celebrating where
know.
they are.
They're celebrating where they are.
You know, there's nothing that they could do about it in the moment, long term.
And
you
we
know,
don't actually
so.
know
Or short
how
term.
healthy they are because there are skinny people out here doing coke and drinking Red Bull every day. But just because they're skinny, we assume they're healthy.
Yeah, and there's a lot of medical conditions that causes weight gain, right?
Thyroid issues.
Thyroid issues. And one misconception that we get all the time, so liposuction is not a weight loss surgery, right? Patients come to us saying, oh, I want to lose weight. We don't remove that much weight when you do liposuction, right? Liposuction is really removal of targeted fat from the body. You don't lose weight. There are weight loss surgeries, right? That is specifically made to lose weight, like gastric bypass and sleeves and whatnot. But the liposuction itself, it's not like, oh, I'm going to lose 25, 30 pounds
Right.
with a liposuction.
Does the fat come back if somebody
Great
lipos
question.
it off?
Great question. So it's a myth. People think that the fat grows back, but the fat that where we remove the fat from doesn't grow back in that specific place. So you're born. We get this question all the time. You're born with, let's say, a specific amount of fat cells all around your body. When you gain weight, that cell expands. When you lose weight, that cell deflates. When we go in liposuction, we're removing those fat cells, right? So when, let's say, we liposuction the belly, the front, we remove about, let's say, 60, 70, 80% of the fat cells from that place. So if you gain weight, you're going to gain a little bit of weight in that area because you still have 20% of the cells, but you're going to get most of the weight elsewhere.
So like that's why the shoulders get
That's
big.
what you said. Exactly what you said. So You have George and I.
No, it's serious. She said the shoulders get bigger after lipo. Is that maybe if you gain weight and they don't go there anymore, so now they might be going here to your arms, right?
I've been seeing like
Exactly.
you saw the King Kong picture, like
No.
was it King Kong?
Oh yeah, that's
But he got lipo.
listen.
And he like
Hilarious.
And George and
We'll
I
send it to you.
really stress to our patients after surgery. We tell them, listen,
Or Donkey
we're
Kong,
just
sorry.
part of your, journey.
Yeah.
After surgery, it's extremely important to work out, to watch your diet, to make sure you're healthy. Very, very important
Yeah.
for one, good results. Two, for your health.
Yeah. Makes sense.
You know, sorry,
No, go
but
ahead.
surgery is still surgery. You know, heart surgery is surgery.
Yeah.
Lung surgery is lung surgery. Plastic surgery is surgery. So you can get a lot of complications. You can bleed. You can get an infection and all that. So you're taking that risk. You're paying all that money. Use it as a jump start to something good.
Right.
So honestly, I'm very happy. A lot of my patients, I make them promise me, okay, look, I'm doing this to you, but promise me that you're gonna take care of this, take care
Yeah.
of yourself,
Yeah.
and use it as a jump start, not as a cheat.
That's
You know,
why he
not
has
as a
trust
cheat.
issues because he get lied to on a regular.
I have one last question though. It's
Wait.
super important. What do you guys feel about breast implant illness? Because I get a lot of flack about that. Like I'm overall very healthy. Like I eat healthy, and every once in a while I get a comment that's like, "But you have implants," which I got a billion years ago. But of course I want to redo them, and people have said, "Oh, yeah, I never been sick because of my implants." Not that I know of. Like I've always felt good. So
Yeah. It's gaining more and more traction. I think it's gained more traction in the last 2 years or so. It is a thing. Breast implant illness is a thing. Unfortunately, it's not a really well understood disease.
Yeah.
Right. It's usually a disease of exclusion, meaning, you go to your doctor, you have breast pain or you have
Yeah.
joint pains. That's how it usually presents.
Yeah.
Or you just feel unwell. You have malaises. You have, stuff like that. It's just general symptoms. And they try and figure out what's going on, and they just can't.
Right.
And then they figure out, oh, there's breast implants, and patients typically Dr. Google is very, very powerful.
Yeah.
So they go in, they say breast implants, joint pain, for example, and then say, oh, breast implant illness.
Yeah.
It is a thing. Some patients had their breast implants removed
Yeah.
and just felt better.
that just happened to a friend of mine.
Right.
But
Whether
it was leaking. It was a silicone implant
That's a
that was
different issue.
leaking,
Yeah, that's a different
and
That's a different issue.
It was
Breast-
making her super sick.
Yeah, that's a different issue. So when a silicone implant leaks,
Yeah.
often it causes problems, right? Either a contracture.
Even if it can a cohesive gel implant leak.
Absolutely. Yeah. Just
So
leaks less.
saline is better.
All right, so we're gonna
I'm
have to have you
questioning.
So-
answer
I'm
like,
those
wait a
questions
minute.
after
It's a
because
good
we got to
question.
wrap
So-
this up. I'm sorry, guys, but we got to get into our last segment because we're completely out of time. But our last segment is a segment called Toxic versus Not Toxic. So we take a song, and it might be a song from the past or a song recently. Today it's going to be a song from the past, and today up
Robin
on
Thicke.
the we're talking Robin Thicke, Blurred
Blurred
Lines.
Lines.
We're not singing, right?
No.
We are.
They'll sing for you. You'll love it.
Okay,
We'll sing, yeah.
You want to pull it up?
Yeah, I actually already did. I was prepared for this.
This is where the microphone goes.
Everybody get up.
He's the singer and the singer and the duo.
None of us. We
So-
did not get that gene.
Literally could
did
not
Edie.
believe the lyrics when I saw it. I was like, we've been singing this. I've had my students singing it. We played for the kids. And then we're like, wait a minute.
I never even looked at the lyrics until today, literally.
Mm-hmm.
All I know is blurred lines. So I was like, okay,
Yeah.
blurred lines. Like, what, is
Oh,
he
I'm
drunk?
interested to see now.
Oh, so start it off, Kay.
All right. Everybody get up. do. No, I'm just kidding.
So are we
Get
supposed,
to
Okay,
to,
so-
give our, so are we
get to
supposed to
the
give our
main
opinion?
bangers.
Or
You
Yeah,
gotta
Yeah,
do.
so we're gonna determine whether this song is toxic or
Ah.
not because it's people think it's a good family song, you know?
I'm gonna say toxic for everything, just to be on the safe side.
Okay, so maybe we should just start like after
with the toxic lyrics.
okay, now he was close. Try to domesticate you, but you're an animal.
Oh, God.
baby. It's in your nature.
Just let me liberate you.
You don't need no papers. So he's trying to take
No
this.
takers.
No.
Oh, I have a
you don't-
different-
You don't need
This was
papers.
the same. This was the
Oh,
same song
interesting.
where I think
That man is not your
a model
maker?
complained on set
How did
about
that
being
go
sexually harassed.
unnoticed?
I don't know. Like he's basically talking this woman out of marriage. Okay, which I think is toxic. Okay. He said she's trying to he's trying to domesticate her, but she's an animal, and this is
Rawr.
in her nature. Then he's saying that
Just
he
let me
hates the
liberate
blurred-
you.
Yeah, he hates the blurred lines. Okay, he wants her to be her most uninhibited self. Then he starts saying things like, I know you want it. I know you want it.
That's rapey.
It is. It is. And then he goes, one thing I ask of you is to let me be the one you back that ass up on.
Oh wow.
Maybe she went to one of you guys. You
Yeah, I
know?
will say that it's toxic.
He says you're far from plastic.
Oh, so maybe not. It's
Maybe
natural.
not.
It's God given. It's pretty cool.
But wait a second. I'm trying
He
to.
said he goes, he don't smack that ass and pull your hair like that.
Okay, so first of all, to covet your neighbor's wife or whatever is already
she's not
toxic.
married yet.
Well, still, your neighbor's property.
That's
or
not no such thing
person.
as a
Women aren't
property. Women
property.
aren't property.
You know what I mean.
No, I don't.
So yes. Anyways.
Women are
I
not
think it's
supposed
safe
to be
say it's
belonged.
very toxic.
I think it's a toxic song. Is there
Well,
any-
okay,
I'm just
so
surprised
if we're
that-
going off of what Aisha's saying and saying that this girl doesn't belong to anybody, then is it really toxic?
Not saying that she's not dedicated to her man.
Right, that
Like,
shouldn't be
but
the only reason
belonging
someone
to
doesn't harass
seems
them.
like property. You
You
know,
know?
like Aisha's saying she's not property.
She's
not
not
property.
taken for, spoken for, or whatever.
Spoken
If you're not
for.
married, you're single. Are we doing
Okay,
that?
that is true. If you're not married, you are single.
That's true.
Okay, so if you're not married, you're single.
Mm-hmm.
Then what is so wrong about him saying that this man is over there trying to make you something that you're not? You're an animal girl. Like, you should be. Rawr.
Let it go.
I'll love you for you. That man over there, he's not your maker.
But he's not gonna marry that girl. He just wants to have a good time with her, and he's being.
How do you
transparent about-
know?
'Cause
He didn't
said
say
there's
that.
no blurred lines. He goes, he just wants to have a good time. Literally, that's in the
But
lyrics.
you know, first comes love, and then comes
First comes love,
marriage.
not backing it up on the club.
May-
Aisha, how you feel about
Maybe
that?
he's saying marriage ain't for you, baby girl. Like,
That
I
is-
know you don't like marriage. I
That's
know
what
you don't want
That
that.
is what he's saying. What do you guys think?
I am so glad I was not in that conversation.
Right.
I'm gonna say toxic.
I say
Ultra toxic.
I say toxic.
Yeah.
I'm gonna say
agree.
medium toxic.
Oh,
But we all agree it's toxic.
We
Right.
all agree
Good.
it's toxic.
All right, so
This has
stamp
been a
it.
very informative episode, guys. Thank you guys for tuning in. Hope you guys learned a lot. Please be sure to comment, subscribe, and we will have your Instagram handles and your practice.
La clinique privée, it's French for private clinic.
Fancy.
Oh.
But we're interested to see how you pronounce it.
Go ahead.
Can you pronounce it?
Say it again.
La clinique privée.
La clinique privée.
Not bad.
French.
Right.
What about you guys?
She is French, actually.
Let me try. La clinique privée.
Yeah.
Yeah.
good.
Privée.
Le clinique privée.
Perfect.
Privée.
Perfect.
So if you guys
Privé,
can't
like-
pronounce it, he can't work on you guys. It's
No.
only for
It'll
the
be part of that
classy.
20% that gets
Requirement.
turned
Right.
down.
It's for the classy. Thank you
All
guys
right,
so much
guys.
for
Yeah,
coming.
Thanks for
Thanks for
having
having
us.
Thank you. And thank you guys for tuning in. Meeting adjourned.